When psychological injury in military contexts is discussed, the dominant frame is usually trauma, exposure to life-threatening events, catastrophic violence, and sustained danger that overwhelms normal coping mechanisms. This framework has been essential for understanding post-traumatic stress disorder and related conditions. However, a purely trauma-based account is incomplete. Psychological suffering in military deployment also arises from moral conflict, from situations in which deeply held beliefs about right and wrong, responsibility and dignity are challenged or violated. Mental health in deployment must therefore be understood not only in neurological or behavioral terms, but also in ethical and value-laden terms. Values are not peripheral to mental health, they are foundational to it. Soldiers and emergency responders as moral agents. Individuals who serve in the military or emergency services are not morally neutral actors. On the contrary, they are often characterized by strong pro-social value orientations. Two values appear with particular consistency: benevolence, expressed as concern for the welfare of others; universalism, reflected in commitments to fairness, protection of the vulnerable, and human dignity. These values are functionally necessary. Unit cohesion, willingness to place oneself at risk, loyalty to comrades, and adherence to mission goals all depend upon them. The military does not function despite moral commitments, it functions because of them. At the same time, these same values increase vulnerability. The stronger a person's commitment to the welfare of others, the more deeply they are affected when harm occurs, when help is impossible, or when moral expectations collapse. The Janus face of benevolence. Benevolence operates in two directions. On one side, it strengthens empathy and camaraderie, enhances moral motivation and meaning, reinforces solidarity within units. On the other side, it intensifies guilt, shame, and self-reproach, increases emotional exposure to suffering, amplifies moral distress when outcomes are tragic or unjust. Empirical research consistently shows that individuals with especially strong benevolent value profiles report higher levels of depressive symptoms and post-deployment psychological distress. This does not mean benevolence is a liability. It means that moral sensitivity carries psychological cost under extreme conditions. This challenges cultural assumptions that resilience requires emotional detachment or moral numbness. In reality, the absence of moral responsiveness may reflect adaptation, but at the expense of humanity. Deployment as a site of value transformation deployment environments exert pressure not only on bodies and minds, but on value systems. Exposure to civilian suffering. Cultural dissonance. Ethical ambiguity in rules of engagement. Perceived leadership failure or institutional hypocrisy often results in changes to personal values. These changes are not inherently pathological. In many cases, they reflect attempts to preserve moral coherence in disorienting circumstances. Individuals may develop heightened expectations of integrity, reduced tolerance for moral inconsistency, stronger commitments to justice, accountability, or responsibility. Difficulties often emerge during reintegration. The moral environment of home institutions may feel shallow, compromised, or ethically lax when compared to the stakes of deployment. This disconnect produces frustration, alienation, and moral estrangement. What appears externally as irritability or oppositional behavior is frequently a moral reaction, not a personality flaw. Moral conflict as a continuum. Moral strain does not emerge all at once. It develops along a continuum. Moral challenge. Encountering unfamiliar or conflicting value systems requires reflection and adaptation. These experiences can be growth-producing and manageable. Moral stress, persistent exposure to situations in which one knows the morally appropriate action but cannot carry it out, generates intense emotional strain, guilt, grief, anger, or helplessness. Social, psychological, or spiritual support becomes necessary. Moral injury. At the far end of the continuum lies moral injury, a disruption of one's moral identity itself. Core beliefs about oneself as a good or responsible person are shaken. Emotional distress is accompanied by depression, anxiety, substance misuse, or suicidality. There are no sharp boundaries between these stages. Moral injury develops gradually, often in interaction with trauma exposure. Distinguishing moral injury from trauma, fear-based trauma, and moral injury arise through different psychological pathways. Trauma primarily involves threat processing and conditioned fear responses. Moral injury involves evaluative judgment, responsibility attribution, and identity disruption. In practice, these frequently overlap. A combat situation may be simultaneously life-threatening and morally compromising. Intrusive memories may involve not only fear, but relentless moral rumination, questions of blame, worth, and responsibility. This explains why trauma-focused treatments alone often fail to address persistent distress when moral injury is present. Implications for prevention and care. Effective prevention and treatment must therefore move beyond symptom reduction and explicitly engage moral dimensions of experience. Key principles include early education that normalizes moral conflict as an expected feature of deployment, prevention programs that integrate psychology, ethics, and pastoral care, therapeutic approaches that address guilt, shame, forgiveness, and moral meaning. Institutional cultures that acknowledge moral burden rather than stigmatize it, attempts to exclude morally sensitive individuals from service, are neither ethical nor practical. The task is not to eliminate values, but to support individuals in carrying them under extreme conditions. Concluding perspective. Psychological injury in military contexts often reflects not weakness, but moral seriousness under unbearable strain. Soldiers are not simply reacting organisms. They are moral agents navigating situations where no outcome is clean and no choice is cost-free. Any account of military mental health that ignores this reality will remain ethically and clinically insufficient. Understanding values is not an optional supplement to trauma theory. It is essential to understanding the human cost of war.